Hello and welcome to the IoT Leaders Podcast. Me, your host, Nick Earl. This week's episode is a really nice one, actually. It's the theme of IoT making a real difference and a real difference in people's lives. It's a story about care in the community and how IoT can basically turn care from a reactive model into a proactive, preemptive model, about how the move from analog to digital infrastructure is a trigger, and about how COVID accelerates business model change across all of the groups of people and institutions that are trying to deliver social care and healthcare, particularly to elderly people in assisted living communities. It's a very nice story, and also with a very nice person, frankly, Pete Kerly, who's the UK Managing Director of Everon. And you'll hear at the beginning of the podcast that he so much believes in care and looking after people and giving back that we had to postpone the original recording of this because he jumped in a van with two of his mates, which he talks about, and drove off to the Ukrainian border to deliver ventilators. And they've done multiple trips, and he's now going to do another one after recording this. So it's a great story. It's a great example of what's possible. They're a wonderful customer of ours in SI, and this is a really global opportunity. And the idea of building a platform like the iPhone for the assisted care living market. So very, very interesting. I'm sure you'll enjoy it. So let me hand over now to my podcast with Pete Kerly, who is the UK Managing Director of Everon. So welcome to the IoT Leaders Podcast with me, your host, Nick Earl, CEO of SI. And I'm delighted to be joined this week by Pete Kerly, who is the UK Managing Director of Everon. Now, we'll get a lot more into Everon and what they do, but at the top line, this is about IoT making a difference in the community, and particularly around assisted living and bringing the worlds of social care and healthcare together. And it's a very, very good story. It really is something that we can all resonate with, and I think you'll really enjoy it. So Pete, with that intro, welcome to the IoT Leaders Podcast.
Thank you, Nick. Nice to be here. Nice to have the opportunity to speak.
Absolutely. And you know, for our listeners, subscribers, we were going to record this about 3-4 weeks ago. It was all set up, and then we didn't because you gave me a very good reason why you couldn't record. And if you don't mind, maybe we could start there, because you've just done something really wonderful, I think. And it's something which I really admire you for. So maybe you can, because you've been on a bit of a trip, haven't you?
Yes, indeed. Yeah, myself and two colleagues, we drove a 3.5-ton van with medical aid, down to the Ukraine border to support the troops locally, and also part of the stock we took down were hospital ventilators, which was much needed after some of the hospitals being bombed and equipment being destroyed. But yeah, it was a worthwhile trip. It was, we worked out we were in the van for 54 hours together, so we got to know each other extremely well.
You probably got to know a little bit more about people than you.
Yeah, we do. Yeah, some good, some bad, but yeah. But no, all seriousness, it was a worthwhile trip, and we crowdfunded. We've raised over £11,500, so we financed 4 trips since, and we will probably be financing several trips more over the coming week. So you know, the response has been fantastic. Yeah,
it's such a terrible situation, and to do something tangible like that, I think you have everyone's admiration. I know those ventilators, I'm sure, were put to use pretty quickly, weren't they?
They were indeed. We got pictures back within 24 hours, and there was a 1-month-old baby on one of those ventilators, which brings it home and
wow.
Makes it very tangible. So
well done again.
Thank you.
And actually, you know, I guess one of the reasons you did it is that, you know, health and care in the community and is at the heart of of what Everon does. It's what you've done for many years, 25 years, I believe. So maybe we could start there and just say a little bit about what Everon do and your background before we actually get into the IoT part.
No, sure. My background is that I've been in health and social care. It's actually over 30 years, Nick. I've not,
Okay.
I'll take the 25.
I was trying to be polite. I'm just out of university myself, by the way. So,
and I started back in the day when social alarms. Probably everybody will remember a pendant round the neck, press a pendant, calls for help over a landline telephone line. Well, that model has been around for 35 years. I've worked with the market leaders in that, and I guess the market attracted me because it was actually making a difference to people's lives. I've stayed in the industry because it is a lovely industry, mainly working with public sector to deploy such projects. And the big move for me came 2 years ago when I joined Everon, because their offering is very different. They're based in Finland, with operations in Sweden, and the Nordics generally are very well respected for their models of care.
Yeah, exactly.
And they've always delivered digital solutions. They've never sent an analog solution since they started in 2000.
Yeah, they were the leaders. A whole wireless, mobile phones, Nokia, Sony Ericsson. They've been at the forefront for 30 years.
Absolutely. Yeah, absolutely. And it's a very different model that's been in the UK for a long time. And the model within the UK is very reactive, which means that somebody presses a button or there's a sensor that picks up when something has happened. So, for instance, fall detectors, they're picking up a fall and sending a message when it's too late. The person's had the fall and they end up 8 times out of 10 within the secondary care arena. So a huge cost to the health authorities. Whereas what we're trying to do is deliver a proactive service where we use artificial intelligence to detect lots of visits to the toilet, for instance, where there could be a bladder infection. We can detect somebody leaving a property at preset hours where there's early set on dementia, so it can raise an alert as soon as they leave the property, and then the appropriate pathway can be deployed. And it detects falls and slumps, and the technology will build a pattern of daily living, and any deviations from that can raise an alert. So it's really about, as I said earlier, is developing that proactive service so we can get to people before they become a burden to the health and social care arena.
It's interesting that on a previous podcast, we talked about another Nordic company, Essity, which some of our regular listeners, as they say, will know what I'm about to say, but the world's second largest paper company. But they actually, because they make paper, they make nappies or diapers, and they do for the you talk about urinary tract infections for care homes. The idea of sensing changes in the chemical constituents of the urine for residents, and therefore giving alert before the patient actually feels uncomfortable, to actually send the doctor to them so you can anticipate it. But that's one very narrow thing, a very important thing, because somebody at that age, when they then go into hospital, A, it can be pretty serious. B, they can often catch something in hospital or fall out of bed themselves. Yeah. It has massive implications. It's a billion a year segment, the elderly sort of incontinence market, as it's called. But it's a very narrow one. But what you're describing is actually more ambitious. And that's the idea of an AI model that tracks personalized behavior.
Sure.
And it's sort of it's almost more like the security industry, where you do anomaly detection behavior.
Yeah.
But it's based on an individual, not a device. It's not like the device is transmitting more data than it should do, or the device is sending something to an IP address that
Yeah,
it shouldn't
yeah,
do. See, by the way, we see lots of that. We've had a device that was sending data to China recently, and it didn't say in the spec it sent data to China. I'm sure that was just a coincidence.
yes.
But anyway, but it's the security industries around the device. You're doing almost like a personalized behavior model of what is the definition of normal behavior for
Yeah.
individuals.
Well, that's a very good point, because the market up until now has been almost a one size fits all. You get this technology and that's it. But there are people living within supported housing environments that have very different needs, and sometimes their needs get better, so their conditions will improve, and they don't need so much technology. And sometimes they will deteriorate, and very quickly. And that's why our technology is designed to be able to deploy. So what you described with the nappy, we've also got another relationship with a company called Accurate that has an electronic mug that detects how much liquid is actually taken by the resident, so you can monitor hydration. And it's really building a package around the person, rather than just saying this is the technology and this is the solution. And that's the way forward. So it's our proposition is more service led than technology led.
Yeah.
And it's got to be very bespoke to those individuals.
It's a sort of a people-centric IoT model. It's not like it's thinking like almost IOP, the Internet of People.
Yeah.
What we some of the other things that we've been talking about in this series are around healthcare, smart healthcare, and devices. But you're also aiming for a completely different demographic. If you take something like the Apple Watch or other offerings, they're sort of aimed towards, frankly, the healthy people wanting to monitor their fitness or their size, and they communicate to the phone, and then you get all your data, or even I've got some smart scales. Sure I overpaid for, but anyway, I can track my body mass index. I don't know what it means, but I can track it, and it goes up and down. I have no idea why it goes up or down, but it seems to be unrelated to my lifestyle, but it does. But I'm using it as a healthy person who is just curious. You're actually applying these capabilities to people who actually are not IT savvy. They're not IT literate. They don't like technology. They didn't grow up, with technology. The old saying that technology is only technology if you were born before it was invented. So for my kids, or at least anyone born after 2007, the iPhone isn't technology because it was always there.
Yeah.
But for this group of people, I'm sure they're not all towards the end of life, but a lot of them, it's technology, and they're not natural technology users. So maybe you can talk through how you do it, and then from there we'll get into what the benefits are, in particular of bringing these two worlds together that you've mentioned, social care and you've mentioned health, and the stovepipes.
Yeah, indeed.
The years of bureaucracy almost. The analog digital. So first of all, let's start with how do you do that?
So we deploy what we term a hub into people's homes, and that is a unit that sits on the wall, and it has the capability of placing a call on a system, and the residents can speak to the manager of the supported housing, or it can go through to a control center, and they can talk to those individuals and respond to their needs. And our commissioners will have locally agreed pathways around that call process. We then have the ability to add peripherals such as bed sensors, chair sensors, fall detectors, and if they trigger a call, it's put through the hub, which identifies the root cause, and again, the locally agreed pathways will take over. Where we're heading. Sorry, what we're now doing is supporting that technology by the use of cameras, polymorphic sensors, So it looks exactly like a camera, but it's monitoring a room or a house, and you can monitor specific areas as doors, um, areas in the living room where they may fall, their bed, side tables, etc., etc., and it will detect and build a pattern of active daily living. And as I said earlier, any deviations from that will place a call onto the system.
If I can jump in, I'm
Yeah.
glad you explained polymorphic sensors. It's not a word I use every day. And I'm going to assume that a lot of people don't know what a polymorphic sensor is, but essentially, am I right that you're sort of anonymizing? You're tracking the thing without recording the thing. Is that a good way?
Absolutely. In simple terms, it's converting the image of the resident into a stick person. So it's not filming. There's no recording of what's happening. It's literally just monitoring the movement and converting that into data. And so in terms of any privacy, there's no concerns around that privacy, and nobody can go into that camera, and it's all very, very secure.
So you also were talking about the ability to sort of have a modular approach to add things on: bed sensors, door sensors. Is the kettle switched on? I guess your earlier example, are they drinking enough? So you're actually an AI company. It's interesting, sort of what sort of company is Everon? I know the segment that you're in, the community care broadly, but you're really your secret sauce, your IP appears to be this AI software layer model.
Yeah, no, absolutely. Yeah.
And the ability to then add on partners, I guess, people who are maybe listening to this and say, well, I make a device that does this. I make a device, and then this idea of almost like an SDK or an open interface into your platform. Yeah,
no, absolutely. This market has been criticized for years. The fact that it's not open. Interoperability is a big problem, but now we are particularly keen to identify strategic partners that can add value to our proposition. So if there is anybody watching that think there may be an opportunity, I'll be more than happy to have a discussion. But our platform is open. We have APIs and the ability to push and pull data, which is absolutely key when you want health and social care to work together. You've got to position them to make a more of a holistic view on personalized care. So for that, they need data. They need their maybe even their housing data, definitely health, definitely social care, and maybe even medical records as well. So I think in Q3 this year, we're releasing new software that will enhance our hubs to take medical devices, vital sign monitoring. So just to give you a flavor, that would be blood sugar, blood oxygen, blood pressure, weight, and temperature. So the key indicators to identify an exacerbation of a particular condition. But if you look at the most costly conditions to the NHS, that's COPD, which is chronic obstructive pulmonary disease. Then you've got chronic heart disease, you've got diabetes, and all of those can be monitored remotely with the objective of reducing unplanned admissions into secondary care. So,
and the more you can, as they say in the old cowboy movies, head it off at the pass rather than deal with it after.
Absolutely.
The benefits for the individual are huge, but the benefits for the whole ecosystem and the cost, and you mentioned the NHS and by the way, so if I can do a quick shameless advertorial, of course, we bring people onto our podcast who are a member of the SI family. So it is worth saying that we, of course, we're very familiar with you as a customer of ours. Thank you for being a customer, and we helped you with the device and the connectivity and optimizing all of this and bringing your ideas to reality. and it's
No,
something that we are continuing to do as you go on this journey.
yeah, no, I think it's been a very good partnership. We've enjoyed working with you, and the key there is that we are the only cellular solution in groups living in the UK, and cellular in the Nordics has it's been an accepted medium for many a time, but yeah, it's proving very successful for us. So that's good.
And there's a government, thank you. And there's a government. I mean, frankly, there is a national initiative, isn't it? I mean, we have listeners all over the world. I get some very interesting emails and LinkedIn requests, lots of LinkedIn requests for people who say, "Oh, listen to your podcast, can we connect?" But so it's not just UK, but the UK is going through this digital switchover, isn't it? And that is actually, I think, been a trigger for the opportunity that you face, because we're going from analog to digital anyway, which is a big thing that the government's driving, which then sets the sort of base foundational framework. And then you're saying, well, now we're going to use cellular and not rely, for instance, the Bluetooth to the smartphone, smart device.
Yeah. Yeah.
Because, as we said earlier in your segment, that's great, but these people won't use it. So there is this national switchover, isn't there?
There is. OpenReach and BT have a program of upgrading all of their exchanges. I think the target date is 2025. So there are 1.8 million users of assisted living solutions in the UK. So and the majority of those are on analog solutions, so they will have to be upgraded for 2025. All of them will be hardwired systems. So hardwired systems are.
Oh, no, you know what? We love it when people's pets. You can't pick him or her up, can you? Because we love it when people's pets enter the podcast. We absolutely love the unexpected guest.
That's my neighbour relocating their bin.
Okay, well, let's assume that the dog's.
He'll settle down in a second.
Should we wait a bit? The agency will probably have some of that in there, and they probably edit this bit out just to give them some instructions. Should we? I normally, so I'm sure the agency won't put this in because it's a Thursday. I normally have the gardener where we live. Nobody comes on a Thursday, okay. And I say to him, his name's also Nick, and I say to him, Nick, work at the back of the house. I'm at the front of the house. I say, work at the back of the house. Don't use the leaf blower. He always forgets. And so typically about this point in the podcast, this huge noise comes and this shape appears, which no one can see at the moment. Right. Yeah. And Nick the gardener with his leaf blower and his bins on his ears, can't hear anything.
Yeah.
I'll get on the window. So anyway, as the neighbor's dog.
Sorry about that.
Yeah. All right. So the digital switchover, I mean, the numbers that you quoted are enormous. I mean, the addressable market is absolutely huge.
It is. Yeah, it is.
But it seems to me, it seems obvious that, but it's not like an ordinary, SaaS company startup. The addressable market is tens of millions or whatever it is. The fact is that some of the barriers, it would seem to me, the barriers that you face on adoption are often to do with siloed bureaucracy, the way public, care in the community works.
Yeah.
I mean, people, you have to connect a lot of people who aren't used to collaborating with each other. Data gets sent between each other serially. It might get there, it might not. You're actually describing a new world of sharing and just at the highest level, social and health are completely separated.
Yeah, they are indeed. And, the government have wanted them to get closer and, get close where they're actually sharing the tea, coffee and biscuits. And that's never really happened. But certainly I've seen a change, definitely in London, definitely in Scotland, and the bigger authorities like Birmingham, where they are now working together and planning together and actually sharing some budgets. So I can see that changing enormously. It's an interesting time. you talk about barriers. I think one of the barriers is that our solution is so far ahead of what has been the traditional model. It's almost, it's not quite concept selling, but it's almost, an educational process to demonstrate what can be achieved by deploying digital solutions, and they've never had that before. So it's really interesting, but it's really enjoyable because you see people sitting there and then suddenly the light bulb switches on and they really get into it. So
you say things like, so this means that instead of doing this, I can do that, or I just receive that. And that light bulb moment.
Absolutely. I mean, I'll give you a good example. We've just won. We were very fortunate early on to win a contract with Clarion Homes, and that's upgrading 200 supported housing schemes. I think it's a total of 6,000 residents over a period of 10 years, and it's very, very good for us. But I had several drivers. Their biggest driver was every month they refer to their scheme managers as Live Smart managers. That Live Smart manager had to go around and physically test the scheme once a month. So it took a whole day. So immediately, by using our technology, because it is digital, because it's online and you can see if there's a problem and it alerts them immediately, it saved them 200 days a month. And they could sort of divert that resource to other things.
Yeah. So and Peter, I was going to actually refer to that because I was thinking, okay, it's really obvious. I mean, even at a personal level, you think, well, this is obvious. Why hasn't it happened so far? I mean, it is really obvious and a great use of IoT. But then you think, well, who do you sell it to? Who's got the budget? Who makes the decision? And so, you're bringing together different groups, different government departments, councils, there in the community. So if that's not difficult enough, and then you have to say everyone's looking at each other, wondering who's going to pay for it. But so finding the ROI, I mean, the personal ROI, which this is really good for the patient, is obvious, but finding the financial ROI is key. And was that the key, perhaps, in this Clarion contract? Was to say you needed to show them, but in this case, you set that process saving that you talked about. They could divert the funds. I mean, finding the financial ROI in terms that they understand must be a part of your business.
No, it is, and yes, that was part of the decision process that Clarion took. But also, I think, they are managing a lot, they have a huge assets across the whole of the UK. From a housing perspective, they're one of the largest housing providers in England. So being able to manage those assets remotely was really key. I think for me, every local authority has a duty of care and provides technology within supported living environments. The big thing for me, talking about ROI, will be when we deploy our telehealth, as I described earlier. So being able to monitor people in their own homes, their vital signs. If you think every GP knows what I term as a frequent flyer, so that will be somebody with, let's suggest, a COPD, doesn't manage the condition very well, and will go into hospital 5 times a year. For maybe up to 5, 6, maybe more nights. So, an average hospital visit, will be £1,500. So we know that by monitoring a COPD patient, picking up on an early indicator, which is normally temperature, seeing a slight incline in their temperature, and then, we will have a locally agreed pathway with the GP. But just by saying to them, take your rescue medicine pack, they'll take that, which will be antibiotics, and that is the job done. Then 9 times out of 10, that will be the end of that exacerbation. So, the real return for me, and we're talking millions, will be within the health arena.
Do you think that COVID has accelerated the understanding of this? And what I mean by that is, COVID clearly put a lot of pressure on hospitals
Yeah,
to free up the beds.
yeah,
And
absolutely.
so what you're describing is the fact that people never get into the bed in the first place.
Yeah,
They don't need the
yeah.
5 visits. So do you think to some
Sure.
extent COVID has accelerated the adoption of this
Yes,
technology?
there is absolutely no doubt. Um, it's changed the mindset of the clinical arena, even down to the GP. When did you, pardon, previous to 2 years ago, when did you get a remote consultation from a GP?
You couldn't. My GP, I've talked about this on the previous podcast. I I couldn't, and my GP, and I live in a nice part of the world, in an advanced country, UK, but my experience of going to a GP was not only did I have to go to the GP, but actually you had to get there. It opened at 8:30 in the morning. You had to get there about 8:10 to join the queue of people
Yeah,
who
yeah,
actually go in and say, "Can I have an appointment, please?"
yeah.
So you stood outside with people who were sick in the winter, and it
Indeed.
was raining, and
Yeah,
there
yeah,
wasn't a cover. I mean, it's
yeah,
great. You drive past and there'd be a line of people.
yeah. No, indeed,
Can I have an
indeed.
appointment, please? Oh
Yeah,
well, he or she isn't free. I mean, I was sit in the waiting room. We'll call you. Now it's, can I have an appointment? Yeah, the doctor will call you back, or would
yeah,
you like a video?
yeah,
And that was all obvious a few years ago. I mean,
yeah.
it was
No, indeed. But
technically completely possible, but
there's
COVID made it happen.
Yeah, it did, absolutely. Another example of the benefits of our technology and the partnership with yourselves was that when COVID broke, they were developing these and deploying these temporary hospitals.
Yeah.
So NHS Digital were looking for solutions that could be installed by the nursing staff. They didn't want engineers in those environments potentially bringing in infection, and so we ended up installing into 7 temporary hospitals across Hampshire and Dorset, because it was cellular based, because it just plugs into the mains. So we had the kit delivered. We had an engineer sitting outside in the van, and the nursing staff were installing all of the units, all of the hubs in each room, and deploying the pendants to the patients. So we could see the units coming online, and then we could also see if there was any issues with coming online for some of the units. But it worked really, really well, and they were deployed for 6 months. They were used as temporary bed space to get people out of hospital before they went home. And what that has done is raised our profile within NHS Digital, and we're now running a couple of other projects with them on the similar basis. So, it's amazing how COVID has suddenly pushed things forward. I would say for something that would normally take another 5 to 10 years.
Maybe more.
Yeah, yeah,
Yeah, it's suddenly let forward, and we're not going to go backwards. We have another client in a similar arena, and at some point, you guys will no doubt be partnering in the US. Of course, it's a different system in the US. You have the clinics and the hospitals, which are
yeah,
profit centers in their own right.
yeah,
But they are the first people to create, you talk about cellular connected medical grade devices. So the way they do it is they're called telehealth. Also have another company called AccuHealth. But they've created the world's first cellular enabled instrument, so like an SpO2, a blood
yeah, yeah,
oximeter, and a blood pressure and whatever. And so the idea is that you may be in a hospital bed for a day or two, and then you go home, and they say go to Walmart or Walgreens
yeah,
or whatever, CVS, and I ask them for this box, and inside and get it, and
yeah, yeah.
inside the box are 6 medical instruments that you normally only find in a hospital,
Sure.
and instructions. And when you switch it on and they connect cellular, now in their case they go to telehealth, and again it's a similar AI engine which gives the data to the clinician, so the clinician can make certain decisions on it. But in both cases, yourselves and themselves, what they need is ubiquitous, i.e., out of the box, single button press, 100% connectivity.
Absolutely.
So all of these things have been great in theory, this is my second little advertorial. Some of these things have been great in theory, but if you're getting 92% connectivity in your field, that's 8% of people that you can't monitor.
Sure.
And so the implications, if you're selling coffee, okay,
Yeah.
it's 8% of your cups of coffee. If you're monitoring people, there's a much bigger implication. So
Sure.
in both cases, the idea of, what we offer, 100% global connectivity from a single SIM, is really important, because you don't want to worry about that, do you? You just want it.
Oh, absolutely not. Yeah, no,
Yeah.
absolutely not. Yeah, no, it's got to be, and it works. And that model you described in America is definitely the way we have to move in the UK.
Yeah,
Definitely
go that way. I think it'll take time, but you're actually one of the disruptors, so to speak. Let's try and bring it to a conclusion. It's a very exciting area. Polymorphic sensors, Internet of People, monitoring things, bringing health and social care together, predicting anomaly detection behavior applied to elderly people.
Sure.
Very exciting. Any over and above rolling out your current solution to more locations, homes, is the big push for you guys now sort of this platform thing we talked about right at the beginning, the idea of there's a whole world of ecosystem partners, a whole world of people. I mean, we see them, hundreds, if not thousands, of companies that make products that, we could measure everything, how often you, as I said, put the kettle on, but you talk about drinking, opening the fridge. I mean, there's no shortage of things that can measure behavior, and wearable devices as well. Is that your sort of strategy, is to have a sort of open platform with to allow people to plug in on top? So in effect, enable them to create a recurring revenue stream on top of your platform, and
absolutely,
you win the home, you have the platform, and then they can clip onto it and create a recurring, sort of like the iPhone and the apps.
In
existing living space.
That's a good analogy. No, that's exactly it. But I think the other big driver for me is, because of the reactive the reactive model that we have, all the services that are delivered by, I think it's 145 control centers around the UK, some privately owned, some run by local authorities. They have staff sitting there waiting for a call to come in, because when someone's fallen, they press the pendant.
Can I help you?
Comes in. One of my big objectives is to change that model
to be reactive, proactive.
Definitely, and analyzing data rather than just waiting for a phone call to say Pete's fallen. Looking at data, predictive data, and then providing interventions appropriate at a time before it becomes an issue. And the other thing we've got to do as a business is, I think I touched on it earlier, is that people suddenly, their condition suddenly deteriorates. So we have to be agile as a business to be able to deploy the appropriate sensor or technology or service to meet that need. And we've got to be able to say to our people, look, your resident is now not needing that technology. We can take it back and have it on a rental basis rather than forcing them to buy it, and
take the barriers away and move it around.
Absolutely.
Endless possibilities, and a great story. It's a real use case, but at the human level, a great story is one we can all relate to. I mean, we're all getting older, and health issues and relatives, and it's really the promise of IoT to make a change in people's lives for the better, and communities. And just a final point, you mentioned the UK. Of course, the demand for this outside of Western countries is also huge. We do a huge amount in Africa, as I think
Sure.
fresh water and light and whatever to millions of people in Africa using IoT and helping design solutions for that. But the healthcare arena, the potential, you're starting from a much further point back. Any final thoughts on global applicability? I know you're focusing on the UK right now, and you talk about Nordic, parent company, Nordic.
Yeah. Yeah.
But really, if we're really talking about changing the world, the ability to allow emerging countries to leapfrog, it would seem to me to be an unbelievable prize.
It's for me, it's a worldwide model, and it can be deployed in any country. But Everon Group, as you say, is based in Finland, operation in Sweden and the UK. I would be keen to see it deployed elsewhere.
Sounds like you got another customer phoning you.
Oh man, sorry. Yeah, it's but yeah, no, it's a worldwide model. It's a worldwide model, and especially.
Anyway, shall we pause a bit and let that phone go to answer?
Yeah. I switched the phone off and didn't switch this off, but I'm going.
Right, all right. I'll just do the last bit of what. Hopefully, I'll do the last bit of.
Yeah, sorry.
For the editing team, why don't we just pick it up from? I've just said to Pete, it would seem to me to be the big prize or whatever is to apply this to emerge, and then you'll give your answer. So the big prize would be if we could apply this to third world emerging markets. Seems to be like the huge prize, and so it's not just a Western country opportunity, is it?
No, not at all. It's a worldwide model, and Everon Group is ambitious. Obviously, the UK has an immediate objective to meet the need of the upgrade for the digital platform. So, but yes, I think group wide will be planning to look to deploy elsewhere.
Right. It's any more trips planned in the van with your buddies?
Yeah, I think we'll be going down in a couple of weeks for another one over a weekend. So yeah, I mean, we've hooked up with a local charity in it's the Canterbury and Ashford, Kent, Ukraine appeal, run by a young Ukrainian lady who does all the logistics. We just provide the resource and the finance to get the aid down there. So it's a good match, and it's nice to see the results of the hard work.
For any of our listeners, if they wanted to help you financially, in just to so you can deliver a few more ventilators or do a few more trips in the van, the boys in the van for 50 hours or whatever it was you said. Sure. Is there somewhere they could, just a website they can go to just to contribute? Yeah,
there is a Just Giving page, and it's a Ukraine appeal, and I think the amazing thing is, Nick, we asked for £2,500 initially. We just wanted to do the one trip, and we've raised 11.5. It's fantastic. So it's all going to a good cause. But yes, a Just Giving page. I think it's called, and I didn't realize you're going to ask me this, so you've caught me on the hop. It's I believe it's the Pete, John, and Clive appeal, the Ukraine road trip. So I'm sure people will find it.
Sounds like a film script.
Yeah, it does, doesn't
it? Pete, the Pete, John, and Clive, justgiving.com. Ukraine appeal. I'm sure there's enough information there for our
they'll find it.
Savvy audience to find it.
Indeed.
And really talk about making a living in people's lives, not through technology in this case, but actually just through basic humanitarian caring, and it's a wonderful thing. So well done again.
Thank
Pete,
you.
We're gonna leave it there. It's been very, very interesting. I suspect you might be a repeat guest. Because I think that in the future, there's so much potential for this. And as I said, I think there's so many different partners who can say, well, if you've solved that problem, can I clip onto it and actually build the ecosystem on top, which is what this is all about. So thank you for joining me. Thank you to our listeners. This has been the IoT Leaders podcast. If you want to get in touch with me, I don't have the Just Giving page, but you can actually find me on LinkedIn, Nick Earl, and you can send me messages and suggestions, as many of you are doing. But in the meantime, thank you to my guest, Pete Kerly, who runs Everon in the UK. Such a really great story about how IT is making a difference in people's lives, and indeed what it could do going forward, not just in the UK, but globally. So with that, thank you for listening, and I look forward to talking to you.
Thank you, Nick. It's been a pleasure. Thank you.
Thank you.